Hi, everyone, and welcome to the Hippocratic Hour Medicine, Policy, and Practice, the podcast where teens ask big questions about health, science, and the world around us. I'm your host, Milan, and today we're talking about a condition that kills millions of people globally diabetes. We often hear about diabetes in kids and teens, but what many people don't realize is that diabetes is a lifelong condition that can affect people very differently as they age. From managing daily blood sugar to understanding long-term effects on the body, diabetes impacts not just individuals, but families and communities too. To help us understand this better, we're joined today by Dr. Anand BS, a diabetes specialist who works closely with patients across all ages. We'll be talking about what diabetes really is, how it changes over time, what long-term effects people should be aware of, and what teens can learn now to protect their future health. Whether you're living with diabetes, know someone who is, or just want to learn more, this episode is for you. Let's get started. Can you introduce yourself, Dr. An?
Yeah, thank you for this opportunity. My name is Dr. Anand BS. After this medical graduation, I have been working since the last 5 years. Initially, I worked for 2.5 years in Indian Institute of Diabetes, which is a diabetes hospital which is situated in Trivandrum, Kerala, India. After that, currently I am working for the last 1.5 years in a central government hospital in Bangalore called HAL Hospital. Currently, I am pursuing my career there.
Great. Okay, so Dr. Anand, we can start with what is diabetes and how is type 1 different from type 2?
Yeah, per se, diabetes is a condition where body cannot effectively regulate or manage the blood sugar levels. It can be either due to lack of insulin or little insulin or insulin. There's a term called insulin resistance, where the cells or the tissues in our body doesn't respond well to the produced insulin. For that, we need to understand a little more. Glucose per se is the main source of energy for the body, and to move it from blood into cells, we need a hormone called insulin, which is secreted by a gland in our body called pancreas, which is situated in the upper abdomen. And if the insulin does not work properly, or there is a reduction in the amount of secretion of insulin, the blood sugar gradually rises. That is the basic pathology. And there are two major types of diabetes. Diabetes is totally dealt in two broad areas. One is type 1 and type 2, which are entirely different to each other in cause, treatment, and underlying mechanism. Actually, 90 to 95% of the diabetes burden in the world is due to type 2 diabetes. Even though we will have a slight look onto what is type 1 diabetes and how it is causing. Type 1 diabetes, it is usually seen in teens and children, but can affect all ages, but usually seen in children and teens, where our body's immune system attack mistakenly to our own pancreas, that insulin producing pancreas cells. Pancreas has actually three types of cells: alpha, beta, and delta. Alpha cells secrete glucagon, beta cells secrete insulin, and delta cells secrete somatostatin. Our topic of interest here is insulin. And in type 1 diabetes, our body, which itself produces antibodies which attack on the beta cells of pancreas, and this beta cells will be destroyed vastly. So there will be little or no insulin secretion from the pancreas side. It is not caused by lifestyle. That is one thing we have to notice. Teens with type 1 must take insulin for their lifelong, because their pathology lies in the insulin secretion itself. The body is not producing the required amount of insulin. So the treatment is insulin only, but there is no it is not reversible. They have to take insulin for lifelong. Coming to the symptoms, it is doctor's time we will call it polydipsia, polyuria, weight loss. Polydipsia means increase in thirst. Polyuria means increase in urine output, and weight loss. On an outlook also, we can say if a patient comes to a hospital, patients will be generally very thin. Management, as I said earlier, it is only insulin, no tablets will be efficient. And we are coming on to type 2 diabetes. Age, age group we mostly see type 2 diabetes is more than 35 to 40 years, but now recently we are seeing younger individuals also due to the higher incidence of obesity among young individuals nowadays. The body makes the difference with the type 1 diabetes. In type 2 diabetes, the body makes insulin, but there is a term called insulin resistance. Body makes insulin, but there is increased peripheral resistance to insulin, often linked to genetics or excess weight and low physical activity. And since there is increased peripheral resistance to insulin, the demand of insulin increases. So the pancreas has to work hard more, and there will be a stage where there is increased workload of beta cells of pancreas, where there is a stage called hyperinsulinemia, where our pancreas will compensate for this insulin resistance. In that stage, if you are diagnosing diabetes, it can be treated by oral drugs or lifestyle changes. But if this condition continue for a long term, that over years, there will be this our pancreas gland will eventually give up. So there will be gradual destruction of beta cells and insulin level will decrease. In that stage only, if you are diagnosing the diabetes, then we have to give insulin. And treatment of type 2 diabetes, if you are saying in a broader aspect, there is we have to advise physical activity which will help in weight loss, dietary modification we should advise, oral drugs we can advise, or if we are finding out the patient is having diabetes at a later stage only, we should start insulin. Yeah, that's it about type 1 diabetes.
Okay. There's this common word, insulin. Can you explain insulin in a way a middle or high schooler can understand?
Insulin is a hormone, or in a more simpler terms, insulin is a chemical messenger that is secreted by a gland in our abdomen called the pancreas, that helps our body to manage blood glucose or blood sugar levels. It is synthesized by, as I said earlier, beta cells of pancreas. Okay. If we have a meals, immediately following the meals, the food turns into glucose in our bloodstream. Insulin acts as a key to transport or to move this glucose from our bloodstream into our cells. Cells means it is muscle, fat or liver cells. Those are the cells. And our cells convert this glucose to produce energy or store it as glycogen in the liver. And insulin also promotes conversion of excess glucose into fat. This is a process called lipogenesis. And without enough insulin, or if your body doesn't respond to it well, glucose level gradually start to increase in blood. The thing you have to understand basically is it is a chemical messenger which is secreted by our pancreas, which will help the body to maintain the blood glucose within normal level. It comes into action following a meal when the sudden surge in blood glucose in our blood, comes. The insulin acts as a key to push the excess glucose from our bloodstream into cells, so that the glucose level in our blood will comes back to normal range. And if there is a defect in this secretion of the insulin by the beta cells, or if there is improper utilization, or peripheral tissues become more resistant to the actions of insulin, there will be the problem starting. The sugar level gradually begins to creep up. That is known by a condition called diabetes.
Okay. So, could healthy people be slowly giving themselves diabetes without realizing it?
Yeah, definitely. Seemingly healthy people can slowly giving themselves to diabetes without even realizing it. Many people can slowly drift towards insulin resistant and pre-diabetes over years without even having any obvious symptoms. Meaning, many people are unaware that they have it, until and unless complications arise. Type 2 unlike type 1 diabetes, type 2 diabetes mellitus does not develop in overnight. It will take its own a long period like 10 to 15 years. The insulin resistance built very gradually. Cells stop responding well to insulin, so the pancreas has to work harder producing more insulin. Blood sugar creeps up. But on the initial stages, if we do the routine blood investigation, the blood sugar value is still within normal limit until it's not. Eventually, the pancreas will exhausted, it will give up, and the insulin secretion beta cells will get gradually destroyed, and eventually the blood sugar stays very high. That is at a point we usually that old aged people will realizing that is they having type 2 diabetes. By that time, complication might have already started.
So, does eating too much sugar actually cause diabetes, or is that something we all grew up with? Like I always hear my parents talking about how I should never eat too much because I'll get the disease. But is that true?
Eating sugar does not directly cause diabetes, but eating too much sugar for over a long term is a scientifically proven independent risk factor for developing type 2 diabetes. The idea of sugar causing diabetes, it is not a lie or myth. Okay, it is definitely true. The issue what often comes with high sugar intake. If we take high sugar intake or empty calories or like energy drinks or refined carbohydrates, there will be weight gain. It will lead to insulin resistance. It will lead to high blood sugar over a time and eventually type 2 diabetes. Sugar is not a single villain actually. It is a contributor. There are some major 5 to 6 factors is there. This unhealthy lifestyle and this refined carbohydrate, uncontrolled sugar intake is one of a contributor. And this liquid sugar is more of a villain actually. And high if you have if any person is taking high sugar intake for a long period, body produces more insulin to produce this to move this glucose from blood into cells for energy, and continuous high consumption is there for like 5 to 10 years. This pancreas has to work over time, and eventually body become resistant to high amount of insulin, meaning glucose will stay in bloodstream for a long time. So high blood sugar level rise up, type 2 diabetes will follow. Another thing is if high blood sugar if a person is taking for a long time, there is a thing called lipogenesis where liver will convert this excess sugar into fat. So it will cause a condition called fatty liver. A scientific term is NAFLD, non-alcoholic fatty liver disease. So the fact is, long-term high sugar diet for long years with a little activity and weight gain very much increases your risk in developing type 2 diabetes. It may not be happening in all individuals who are taking type 2 diabetes. It may vary from person to person, but it is scientifically proven that it will significantly increase your risk for developing type 2 diabetes in future.
Okay. So in the past, I've noticed how two people who are very similar, they eat the same diet, but only one person gets diabetes. Is that luck, or are there other factors related?
Because food is only one piece of a much bigger puzzle. Two people eating same diet can have different diabetes outcome due to variation in genetics, metabolism, or gut microbiome, or lifestyle factors. While diet is one of the risk factor, underlying genetic predisposition, stress level, sleep quality, and physical activity levels, they are also there to determine insulin resistance and type 2 diabetes. Genetics is there. Some people are born with some genes which will make them more insulin resistant and make their pancreas wear out faster. And if two people who are taking exactly similar diet, And if only one of the person has a very strong family history, that if only one of the person has a significant history that diabetes is run his family, that patient has a higher chance of developing diabetes compared to the other person. And the insulin sensitivity also differs from person to person. Some person muscle cells and liver respond very nicely to insulin, another persons may not. That person's pancreas has to pump out more insulin, and over time that person's system or pancreas will eventually fail. And there is one other thing called body fat distribution is there, where the visceral fat or belly fat, if two persons are there who take exactly same diet, body weight are exactly same, but one person is having belly fat, for the other person fat is deposited under the skin in thigh or legs, whatever. The person who is having abdominal obesity, that is belly fat, is more prone for developing this diabetes. And along with this dietary factors, other factors include this lack of exercise, sedentary lifestyle. Sedentary lifestyle, the muscles will be less active. If a person who is doing a very good physical activity on a daily basis, his muscle will be using this excess glucose to produce energy. In that person, the insulin sensitivity will be more, or in other times, insulin resistance will be less. And yet, so many other contributing factors are there. Many of the consultants will not be addressing that properly. They are adequate sleep, consistent sleep, and chronic stress. And if chronic stress is there, the patient will be there is a hormone called a stress hormone. It is called a hormone cortisol. If a patient due to whatever stress, work-related stress, trauma, financial burden, if the patient is undergoing a chronic stress, this cortisol hormone comes into play. It will elevate the blood glucose level, and it will further leads to weight gain, insulin resistance, and type 2 diabetes. And sleep deprivation can, if for a long term person is not having adequate sleep or poor quality of sleep, it can also lead to weight gain and contributing in a similar way. And another two possibilities are smoking and alcoholism. Smoking is a chronic inflammatory state, and it can cause insulin resistance. Regarding a chronic alcoholic patient, it can cause weight gain. Chronic alcoholic patient. Another part is this alcohol is a potential pancreatic toxin. It can damage pancreas. So, if two person who are taking same diet, only one gets diabetes, means that the person who is getting diabetes has significant other contributory factors. He is having genetic predisposition, genetic susceptibility. Diabetes may be running in his family. There may be he is having unhealthy food habits may be there, stress level, sleep quality may be poor, reduced physical activity may be there. So some 7 to 8 factors togetherly contributing to this diabetes. That is a total outcome. That's the reason here.
You mentioned stress. What does stress have to do with diabetes, and why does no one talk about it? Because stress plays such a big part in our life. What does it have to do with this?
Yeah, stress directly impacts diabetes. What I said was stress. It is also an endocrine abnormality. Means when stress happens, when the person is under a chronic stress, two other hormones comes into play. One is, as I said earlier, cortisol. Other is epinephrine, which will elevate blood sugar, and this chronic stress will lead to insulin resistance. Chronic stress not only worsens insulin resistance, if the person is in a pre-diabetes state, that is stage just before frank diabetes. If the patient is under chronic stress, the progression will be much faster when compared to a normal person. Other thing, if he is an already diagnosed diabetic person, if the person is still under chronic stress, the control will be more difficult, because the opposing hormones, cortisol is there, and high stress level can also cause unhealthy eating, and patient will be having a motivation for this exercise, so there will be lack of exercise, and neglected medication routine. So many factors can be there in chronic stress. So the problem with that, if we see a patient in our routine OPD or something, there is no subjective scale to grade the extent of stress the patient is undergoing. And for every doctors, if a type 2 diabetic patient or a pre-diabetes patient comes into him, naturally we will be giving more focus on diet and exercise. That emotional factors will be overlooked often, and as I said earlier, it will be difficult to measure on a scale this extent of stress the patient is undergoing. And another thing is, this chronic stress is normalized in a modern society. Chronic stress is often considered as a normal part in modern life. I am undergoing chronic stress, you are undergoing chronic stress, everyone is undergoing. So it is normalized. So we are not addressing that issue yet. So in a hospital setup or in whatever, it is easier to say to a patient that eat better, exercise, than to acknowledge his job stress, his trauma, his poverty, his financial burden. He may be having pre-existing depression, pre-existing anxiety. These all factors can together contribute this chronic stress. So we should be addressing. We should give priority to diet and exercise. We should give equal priority to the emotional factors also. At least we should raise a question whether you are having chronic stress, how is your working atmosphere, family atmosphere. Yeah, that's it. It is an area in the modern society we are not properly addressing it. What actually definitely help is consistent sleep. We can practice physical activity. If we are going to a gym or walking, whatever, it will not only help in weight loss or diabetic control, physical health. It will offer some help in mental health also. It will help to relieve. To a certain extent, it will help to relieve this mental stress also, and we can also practice yoga, meditation, or a deep breathing exercise like that. We can practice. Then we can practice. So we can seek help from social support with family, friends, colleagues, and if things is still not getting corrected, we can seek professional help from a psychiatrist, psychologist. We can seek counseling. Yeah, professional help at any point of time. If it is necessary, we should be taking that.
Oh, see, so many of my friends with many of these risk factors, sometimes with stress, genetics, sleep, environment. So are kids today more at risk for diabetes than their parents were or past generations?
Yes. Children today are at a higher risk of definitely for developing diabetes. I am saying about type 2. Children today are at a higher risk compared to their parents due to the increasing rate of childhood obesity. If we go on to school or whatever, we are seeing a lot of teens or kids who are having this early onset obesity. And sedentary lifestyle is there, very poor nutritional habits is there. While genetic predisposition plays a role, environmental factors and lifestyle choices have significantly increased the risk of early onset diabetes. Type 2 diabetes, once it was rare in children and is now frequently diagnosed in teens due to earlier exposure to these risk factors. Yeah.
Okay. So we know a lot about the pancreas, we know a lot about glucose regulation. So if we know so much about diabetes, why is it still rising? What are what is changing in this modern world that is making diabetes become so much more prevalent?
Yeah, sure. Our humanity has made a giant leap in understanding, diagnosing, and treating diabetes. But the disease is rising because of some societal, environmental, and behavioral shift that is moving much faster than our medical interventions actually. This modern convenience promotes a lifestyle that directly causes insulin resistance. Modern environment is designed for inactivity and calorie density. You see, recently it is digitalization, urbanization, industrialization, everything is happening in the modern day world. So there will be less physical labor. All of us will be sitting in front of a chair, looking at screen, looking at computers, working 8 to 10 hours. There will be a sedentary lifestyle. And the sudden dietary shift is there since the last 10 to 20 years, because there is easy access to fast food, refined carbohydrates, sugary beverages, which is very high in calories and a very, which is having a very nutrient content. High in calorie, nutrient content is very low. And there is a term called obesity epidemic. Actually, obesity is not an epidemic. Epidemic is used for a disease which is spread from one person to other person or a vast area. But nowadays, obesity is like an epidemic. Every person is having like that. Each and every person, once in 2 to 3%, we are having this, is having obesity. In other way, we can think about is there is increased awareness and early diagnosis is going on recently in developed countries and in a vast majority of developing countries also. The awareness is more, the screening investigations is now become easily accessible to the general population, so earlier diagnosis is also there. So a part of this rise in numbers of newly diagnosed diabetics is actually maybe a success in detecting cases that may be previously hidden. The cases are previously hidden, now we are picking it up effectively due to the more health awareness, early diagnosis. Means more cases are identified early. And the other biological and lifestyle factors are high stress jobs and poor sleeps. Then while we know how to prevent, we know this data-wise, we know a lot of things about diabetes, its cause, diagnosis and treatment. But to apply that knowledge to a population level, I am not talking about 1,000 or 10,000 population, to apply that on a state level or a country level or a subcontinent level, it is the practical difficulties are more. And we understand diabetes biologically very well, but we haven't created any proper food policy, any urban design, or any work culture, or any social support system. There is nothing there. We know a lot of things, but there is no work culture, there is no proper food policy, which a population generally follows. Nothing like that. It is yet to be established. I think that's the reason why the burden of diabetes is increasing in the modern world.
Know a lot about the disease, but unless proper changes occur, like with lifestyle and other factors, it's not going to
Yeah,
change.
yeah.
So, what are some complications of diabetes? Once you get it and it occurs for a long period of time, what happens after that?
Actually, complications can be divided into acute and chronic. Acute means immediate complication. Chronic means over a period of 10 to 15 years, a patient can develop complication. Acute is will be little difficult terms for you to understand. Acute complications are seen in type 1 diabetes only. Two complications are there. Just you familiar with the term DKA, diabetic ketoacidosis, where the patient can have vomiting, severe abdominal pain, patient can go into coma like that, the severe dehydration will be there. Other acute complication is hyperosmolar hyperglycemic state. Similar presentation, very high blood sugars, severe dehydration, and that are the acute complications in mostly in type 1 diabetes only. Then comes the topic of interest, that the chronic complication which is seen in type 2 diabetes, which can be divided into microvascular and macrovascular. Microvascular means this long-standing type 2 diabetes can affect small blood vessel and it can affect a large blood vessel. If it is affect a small blood vessel, it is called a microvascular complication. There are three complications are there. It can affect retina or eye, it can affect kidney, it can affect nerves. I will just say the name of the term. If it affects kidney and its filtering system, it is known by a term called diabetic nephropathy. If the issue is not getting addressed for a long years, it can keep on progressing and patient will can end up in renal failure, maybe requiring dialysis, renal transplant like that. And other complication is diabetic retinopathy. Long-standing diabetes can affect the blood vessels in retina. It can cause blurring of vision. If unattended, it can cause blindness also. And cataract also, it is very common in diabetic persons who is having the disease for a long time. Other complication, third complication is a term called diabetic neuropathy, when the sugar affect nerves. The presenting symptoms will be the tingling, burning, or numbness, or the extremities, hand and legs. The patient will be presenting with the sensory disturbance. These are the microvascular complication, but the retinopathy and the nephropathy are more topics of concern, because if we know one of our grandma or granddad is having diabetes for 10 to 15 years, we should be screening annually for retinopathy. If a retinopathy is there, if it is gradually starting, if the retinopathy is there, if it is gradually affecting the kidneys, it can end up in blindness. Nephropathy, we should be screening every yearly, or as per the advice per the physician or endocrinologist consultant. And this macrovascular complication means when the long-standing high blood sugar affect large blood vessel. It can cause cardiovascular disease. Cardiovascular disease means heart-related problems. It can cause hypertension, high BP, raised BP. It can cause heart attack. It can cause stroke. Heart attack will be occurred when there is narrowing of blood vessel related to heart. Stroke will be there when there is narrowing of blood vessel which is giving blood to brain. And high incidence which is seen nowadays is a complication called food complication. We may have seen our relatives or neighbors who are having diabetes for a long years, having ulcers in the food, which may eventually end up in amputation or disarticulation of foot, toes, or like that. So the food complication, it is called, it is known by a term called peripheral occlusive arterial disease or peripheral occlusive vascular disease. This is a combination of three diseases. One, there is this narrowing of blood vessel, narrowing of blood vessel, reduced blood flow to the extremities will be there. Mostly foot is the most one affected. Then there is neuropathy will be there, nerve damage. Patient will be losing all the sensations of the foot. And there is chance of infection and decreased wound healing is there due to diabetes. So after years of reduced blood flow and nerve damage, gradually infection will gradually begins to settle in the foot, which can gradually progress towards ulcers, and if not addressed properly or not managed aggressively, which can result in amputation or disarticulation. So the foot care management is a thing of utmost importance in a diabetic person who is having diabetes for so many years. We have to examine the food every 2 weeks or 1 month to look for any abrasions, blisters, abscess, like that. These are the microvascular and macrovascular complications of diabetes. Yeah.
I see. So, for those who are older, like grandparents or older relatives or neighbors, how do teens or even middle schoolers, how do they support them for someone who has diabetes? How would they help?
Yeah, we can help in a lot of ways. If you are willing sincerely, that we can encourage movement, that invite them for a short walk, or we can do gentle reminders for their medication, for their blood sugar checkup, for their doctor's appointment, and help them to. These are small things, but it can bring a change. Help them to organize pill boxes, or help them to put phone reminders for the timings to take medicine. And once in 2 weeks or once in a month, We should make sure that he or she is taking the medication at the prescribed dosage at the prescribed timing without any fail. This old age individual might be skipping, might be complicating things, might be missing tablet, might be missing timing. So, at every once in a while, it should be monitored, and we should be screening for complication. We should bring our grandma or granddad to the nearest hospital once a year or once in 2 years to screen for this complication called retinopathy, nephropathy. At home, we can give the foot care like once in 2 weeks. Like I said earlier, we can look for any abrasions, blisters, any chance, any ongoing ulcers, anything we can look for. Another topic of importance is if the patient is having diabetes and if the patient is taking insulin as a treatment, or if he or she is taking a type of tablet called a group of tablets called sulfonylureas, called glimepiride, glycoside, some tablets are there. In that group of patients, there is a chance of hypoglycemia. Means this old aged patient, the sugar can immediately fall below normal, like 65, it can fall 50, 45. At any time, it can happen. Mostly seen in old aged individuals. The patient will be having shaking, sweating, shivering, confusion. So we should know the first aid treatment. We should keep a candy or chocolate or even some sugar or sugar dissolved in water. We should immediately put orally if the patient is able to take orally. That is a topic of interest that we should anticipate hyperglycemia in an old age individual. And symptoms of hyperglycemia also we can monitor. Hyperglycemia means high blood sugar, very high blood sugar. The patient will be very thirsty, very tiredness, and frequent bathroom trips. Patient wants to pass urine very frequently. So we should monitor our granddad or grandma. If the similar symptom is there, seek a medical opinion. And we should know whom to call in case of an emergency. We can support their mental and emotional health. And another thing is we should respect their independence. We should offer help but don't force anything. And we should listen to them without any judgment. So there are some 60 year, 70-year-old old individual who are having so many diseases. So there should be a person who should listen to them. They'll be very happy with that. And be a good friend with them.
Just about the medical side, you have to make sure that you're connecting with them. So
Yeah, that emotional connection is there. Yeah.
So, another question that our viewers might have is diabetes is usually about an increase in blood sugar, right? So you mentioned some people will have hypoglycemia, right? So why does that happen?
Because it usually seen in two type of person who are taking medications for diabetes. One is insulin. If the person is not taking a proper meal, expected surge in blood glucose level post meal will be less. But we have already given the fixed dose of insulin. So immediately following 30 minutes or 1 hour, there is a chance for reduction. There is a chance for immediate decrease in blood glucose level more than anticipated, like less than 64 something. Suddenly it can cause. And there is one other group of drugs, like I told earlier, sulfonylurea. They are prone to cause. Okay. The thing is, we are advising tablets to all of the patient. We cannot have a strict control. We are giving tablets to one person. I cannot say that, okay, I am giving the required tablets. This patient's glucose will be for the entire 1 month. It will be within 100 to 150. We cannot say like that. It will be so much fluctuating. Sometimes it can go 400. Sometimes it can fall back to 50. So there is always a chance of hypoglycemia. We should anticipate that, especially in old age individuals.
Finally, what are advancements in treating diabetes?
Since this is a disease that causing that much burden to our modern day world, so much researchers development has been going on to this diabetic medication diagnosis field. The recent advancement is in India there is since the last 1 to 2 years there is a GLP-1 agonist, there is a few drugs. One of it is semaglutide, one drug is there. And there is one more drug, GLP-1 and GAP. The terms will be a little difficult for you. GLP-1 and GAP agonist, dual agonist is there. Called a tirzepatide. One of the examples is tirzepatide, which is best for sugar control, best for weight loss, and it has very strong cardiovascular benefit also. Then one more group of drugs is there called SGLT2 inhibitors, which is practiced in India for last 3 to 4 years. More than that, it is there, which is also proven to be far more efficacious in sugar control. Apart from this diabetic control aspect, it has proven beneficial in so many other areas. Like it has proven providing significant weight loss. It has a strong cardio protective action, means it will protect the heart, and it has a renal protective action. It will protect the kidney also. So if you are taking the tablet as a whole over the entire body, it will be offering a wide range of protection. In the diabetic control, it will benefit, it will reduce the chance of heart attack, it is kidney protective. We are walking daily, we are doing heavy exercise for weight loss, but this tablet will help us in achieving the weight loss we are aiming for. And there is one more thing called a CGM, continuous glucose monitoring is there, which is a patch, which will be a circular patch, which will be attached at our arm level, which will provide real-time glucose trends, which will eliminate the need for finger prick. If it is not there, if we want to check the sugar, every time we need to prick the tip of the finger if we need to know the sugar level. If we fix one CGM, this real-time glucose value it will provide. If a patient comes to our hospital with so many fluctuating sugar levels, if we want to monitor his sugar level for continuous 1 week in a graphical manner, we can put one CGM. We can connect it with one smartphone or electronic device. After 1 week, there is a graphical data it will represent, giving us a data about on which date, on which time, after which meals this sudden spike it happened, after which meal, after which drug this reduction in sugar happened. Like that, it will give a complete idea, complete overlook, without any difficulties, practical difficulties for the patient and for the doctor. And there is stem cell therapies is going on, but still in research stages. The scientists are planning to regenerate insulin producing beta cell. The pathology in type 1 diabetes is beta cell getting destroyed by our own body's immune mechanism. Now they are trying to regenerate within the body. If it is happening, it will be a very permanent cure maybe in type 1 diabetes, because with a lot of patients suffering in the modern world. Another thing is insulin pump we used to say, or artificial pancreas we can say, or automated insulin delivery system, that is a proper word. A small device, insulin pump, we can put in our pocket or attach to our jeans with an insulin inserter. A small wire will be there, an insulin inserter will be there, which will be fixed onto our abdomen along with a CGM, continuous glucose monitoring. So it will function 24 hourly or a months or years. The system will automatically adjust itself insulin delivery based on the CGM reading. Over a fixed time interval, it is very much automated. The system will automatically detect what is the sugar level now. It will automatically decide how much insulin should be given. Nothing we have to do. It is entirely automated, but it is costly. It will be a real benefit for type 1 diabetic person or childhood diabetic person. It is yet to come in developing countries in a full stretched manner, but we are looking on to it. Yeah.
Okay. So, as we wrap up today's episode, one thing is clear. Diabetes isn't just a condition. It's a lifelong journey that changes with age, technology, and the support people receive along the way. We learned that choices people make early in life can have long-term impacts, but we also heard something hopeful. that it's never too late to improve health, understanding, and quality of life. A big thank you to Dr. Anand PS for sharing their expertise and helping us understand diabetes not just in teens, but across generations, from young people to older people. If you're a teen listening, remember that learning about health now isn't about fear, it's about empowerment. And if you know someone living with diabetes, sometimes the most powerful thing you can do is listen and support them. Thank you for tuning in to the Hippocratic Hour. If you enjoyed this episode, feel free to share it, start a conversation, or think about how what you learned today connects to your own life. Until next time, stay curious and take care.
Okay.